Hello, my name is Avril Bastians, and this is my presentation for Foundations of Public Health, my project plan, my nutritional intervention. Children cannot choose their circumstances. In Australia, 1 in 6 children and young people are growing up in poverty. This can limit their choices, opportunities, and outcomes in life. A child's right to proper nutrition is stipulated in the World Health Organization Convention of the Rights of the Child. My intervention chooses a population group that is vulnerable. Primary school-aged children between the years of 5 and 12 from low socioeconomic backgrounds and currently in public primary schools. Now, we've identified about 2,191 local government areas, of which 47 fall into that category of low socioeconomic status based on their household income and the level of their parents' education, the highest level of education in that household. Children are vulnerable in that they are reliant and dependent on their parents and caregivers for their health and well-being. And this population group was chosen because of their critical developmental stage and how poor nutrition or inadequate nutrition can affect the long-term well-being and development, and how that has an impact on them both physically, mentally, and also their risk associated with chronic disease later in life, and how this cycle of disadvantage can continue. So to try and address all of these as a public health concern, this was the population group chosen. The nutritional intervention itself, is to create a public health program, a nutrition program involving a nutritionist, and to reintroduce or reinstate a canteen or a facility for food preparation and for the children to be able to sit down and eat at the schools. So really understanding the need for this population group to follow dietary guidelines and also to be able to sit down and eat, and the benefits of these in improving health equity across the populations, empowering parents to maximize their children's health development, tracking the mental health and risky behaviors of the kids who don't eat, addressing chronic conditions and preventative health, and strengthening the entire community support network around these disadvantaged kids. And to do that, yes, we looked at all the current programs that were out there in the community and identified the ones that were already, there were several programs that were addressing some of these or some aspects of this population group and the nutrition and the situation, but not all of them had a nutrition focus. Not all of them included a community education program that included the children, a collaborative one. There were several programs that just provided, for instance, like the school breakfast program that provided breakfast to disadvantaged kids in primary schools, but they didn't do it consistently. It wasn't done every day. And also there was a lot of government funding and private funding that was sort of put into this pool. However, there was no cohesive program that dealt with all aspects of this. And I think fundamentally reintroducing the canteen or having a space for where food can be prepared on the premises and providing it consistently on a daily basis is the solution that I'm proposing. And the goals, the program goal is to increase the ability of disadvantaged, low socioeconomic primary school kids to learn and develop academically, physically, mentally, and socially through free access to nutritious meals and education at school. And the objectives of this program was to improve the educational outcomes through student learning with better nutrition, to reduce mental health issues through proper nutrition, and to reduce the risk of long-term chronic disease on the individual and the public health and the public health system. So the proposal was to create a canteen, provide nutritious breakfast on school days, create parent-teacher groups to oversee, create food app for the program, run a nutrition education session, and for the children to be able to sit down and have their lunch, to develop visible marketing materials to promote and introduce this program and evaluate the program. And the program, finally, the evaluation of the program would be to collect the baseline data on health and academic performance at the outset, and to create 6 monthly questionnaires just to be sent out to the school and to be discussed in this nutrition forum with the appointed nutritionist and the children and the parents and the teachers, and to use combined findings and other government programs to feed into the public health program system. We will provide an annual report for the minister on the program performance. One of the other ideas that came out was to actually review the app data, provide children with an app, and perhaps give them the ability to sort of comment on how the food made them feel, or and aspects of the menu, and how and collect that data that could then feed back into this evaluation process. Thank you very much. I do believe that nutrition is pivotal to the health and well-being, and children are the ideal place to start to begin with.